As medical students and practitioners, you are on the front lines of a global effort to eradicate preventable diseases. Your role is crucial in identifying, treating, and educating communities about these diseases, which can have devastating impacts if left unchecked. Trachoma, a bacterial infection that can lead to blindness, stands as a stark reminder of the challenges we face. This disease, caused by the bacterium Chlamydia trachomatis, is highly contagious and spreads through direct contact with eye discharge from infected individuals or through flies that have come into contact with the eyes or nose of an infected person. This debilitating disease disproportionately affects the world's most vulnerable populations, trapping them in a cycle of poverty and suffering. In many rural and impoverished areas, lack of access to clean water and sanitation exacerbates the spread of trachoma, making it a persistent public health issue. Understanding trachoma, its transmission, and the strategies for its elimination is crucial for healthcare professionals worldwide. By studying the disease's epidemiology and the environmental factors that contribute to its spread, we can develop more effective intervention strategies. By recognizing the signs, providing effective treatment, and advocating for preventative measures, we can make a real difference in the lives of millions. Early detection and prompt treatment are key to preventing the long-term complications of trachoma, including blindness. This essay provides a comprehensive overview of trachoma, focusing on the World Health Organization's SAFE strategy: surgery, antibiotics, facial cleanliness, and environmental improvements. Each component of this strategy plays a vital role in breaking the cycle of infection and preventing the disease from spreading. Join us on Medical Licentiate Emerson as we delve into the world of trachoma, exploring its impact, diagnosis, treatment, and ultimately our role in its eradication. Together, through education, awareness, and action, we can work towards a future where trachoma is no longer a threat to sight. Trachoma is an infectious disease caused by the bacterium. This bacterium thrives in hot, dry, and dusty environments, often with limited access to clean water and sanitation. Transmission occurs through contact with infected eye discharge, typically via hands, clothing, or flies. Repeated infections cause inflammation and scarring of the inner eyelid. This scarring can lead to the inward turning of the eyelashes, known as trichiasis, which scratch the cornea with every blink. The resulting pain and corneal damage can ultimately lead to irreversible blindness. Understanding the infectious agent and its mode of transmission is paramount in comprehending the disease's impact and developing effective control strategies. Trachoma remains a significant public health problem in many developing countries, primarily in Africa, the Middle East, Asia, and Latin America. According to the WHO, an estimated 137 million people live in trachoma endemic areas and are at risk of infection. While the number of people blinded by trachoma has decreased significantly in recent years, thanks to global efforts, the disease still causes visual impairment and blindness in an estimated 1.9 million individuals. The vast majority of these individuals reside in impoverished communities with limited access to healthcare, clean water, and sanitation. Trachoma presents with a wide range of clinical manifestations, from mild inflammation to severe scarring and blindness. Understanding these stages is essential for proper diagnosis and management. The early stages of trachoma are often asymptomatic, making early detection challenging. As the infection progresses, individuals may experience a gritty sensation in the eye, itching, discharge, and sensitivity to light. Without intervention, repeated infections lead to more severe symptoms, including intense pain, blurred vision, and corneal ulceration. The World Health Organization has developed a simplified grading system to classify the clinical stages of trachoma, a chronic infectious disease that affects the eyes. This system helps healthcare providers assess the severity of the disease and guide treatment decisions, ensuring that patients receive the most appropriate care at each stage. The 5 stages of trachoma are carefully defined to help in the diagnosis and management of the disease. First, trachomatous inflammation follicular, TF, which is characterized by the presence of 5 or more follicles, small bumps, on the inner eyelid. These follicles are a sign of early infection and need to be monitored closely. Second, trachomatous inflammation intense, TI, marked by pronounced inflammation of the conjunctiva, often with thick discharge. This stage indicates a more severe infection that requires immediate medical attention. Third, trachomatous scarring, TS, which shows evidence of scarring on the inner eyelid, appearing white or discolored. Scarring can lead to further complications if not treated properly. Fourth, trachomatous trichiasis, TT, where the eyelashes turn inward, scratching the cornea. This condition is painful and can cause significant damage to the eye if left untreated. And finally, corneal opacity, CO, which involves clouding of the cornea, leading to visual impairment or even blindness. This is the most severe stage and often results from prolonged infection and inflammation. Recognizing these stages is crucial for implementing timely interventions and preventing irreversible damage. Early detection and treatment can significantly improve outcomes for those affected by trachoma. Section 6, the SAFE strategy, a four-pronged approach to elimination. The WHO promotes the SAFE strategy as a comprehensive approach to trachoma control and elimination. This multifaceted strategy targets both the individual and the community level to break the cycle of transmission and prevent new infections. SAFE stands for surgery, to correct trichiasis and prevent further corneal damage, antibiotics, to eliminate chlamydia trachomatis infection, facial cleanliness, to reduce transmission through hand and face hygiene, environmental improvements, to improve sanitation and access to clean water. By addressing the various factors contributing to trachoma transmission, the SAFE strategy offers a roadmap towards a world free from this preventable disease. Section 7. Diagnosis and treatment, identifying and combating trachoma. Early diagnosis and treatment are essential for preventing the debilitating consequences of trachoma. This bacterial infection caused by Chlamydia trachomatis can lead to blindness if not addressed promptly. Healthcare providers play a crucial role in identifying individuals with signs of infection and initiating appropriate interventions. They are often the first line of defense in communities, especially in remote areas where access to specialized care may be limited. Diagnosis typically involves a clinical examination of the eye, looking for the characteristic signs of trachoma. These signs include inflammation, scarring, and in severe cases the inward turning of the eyelashes known as trichiasis. In some cases, laboratory tests may be conducted to confirm the presence of Chlamydia trachomatis infection. These tests can provide a definitive diagnosis, ensuring that the appropriate treatment is administered. Treatment for trachoma depends on the stage of the disease. Early stages can often be managed with antibiotics, while more advanced cases may require surgical intervention. Antibiotics. Oral azithromycin is the drug of choice for treating active trachoma infection. This medication helps to eliminate the bacteria and reduce the risk of transmission within the community. Surgical correction of trichiasis is necessary to prevent further corneal damage. This procedure can significantly improve the quality of life for those affected by advanced trachoma. In addition to treating existing cases, healthcare providers must also educate patients and communities about the importance of preventative measures, such as maintaining good hygiene practices and seeking medical attention at the first sign of symptoms, such as hand and face hygiene. Regular washing can significantly reduce the spread of the bacteria that cause trachoma, and access to clean water and sanitation. Ensuring that communities have access to these basic necessities is crucial in the fight against trachoma and other infectious diseases. Section 8. Prevention and control, breaking the cycle of transmission. Preventing trachoma transmission requires a multifaceted approach that addresses the underlying factors contributing to its spread. The F&E components of the SAFE strategy focus on these preventative measures: facial cleanliness, promoting hand washing with soap and water, especially after contact with eye discharge, encouraging face washing to remove discharge and reduce bacterial load. Environmental improvements, improving access to safe and adequate sanitation facilities to reduce environmental contamination, ensuring access to clean water for drinking, washing and hygiene purposes, controlling fly populations as they can mechanically transmit the bacteria. By implementing these measures, communities can create healthier environments that prevent the spread of trachoma and other infectious diseases. Section 9, Conclusion, a call to action for healthcare professionals. Trachoma, a preventable infectious disease, continues to threaten the vision and well-being of millions worldwide. As future healthcare providers, you have a crucial role to play in combating this debilitating disease and alleviating the suffering it causes. By understanding the epidemiology, clinical manifestations, and the SAFE strategy, you can effectively diagnose, treat, and prevent trachoma in your practice. Educating patients and communities about the importance of hygiene, sanitation, and early treatment is paramount in breaking the cycle of transmission. Let us heed the call to action and work towards a world free from trachoma. Together, through knowledge, compassion, and unwavering dedication, we can make a lasting impact on the lives of countless individuals and create a brighter, healthier future for all. Thank you for watching Medical Licentiate Emerson channel. Please subscribe and like this video.